Hello, my name is Will Ospina. Today is September 26th, 2025, and this is my presentation for Dr. Rodriguez's Pathophysiology class. First, I will be discussing diseases. Disease is the name or the designation given to a health problem. A health problem can be characterized by a few things. It could be the combination of signs and symptoms. It could be acute, chronic. It could also be localized, or could even be systemic in the sense of an acute infection. We could think of the common cold, a rhinovirus. Something more chronic could be something such as cancer. In the example of a localized disease, we could say that maybe an abscess, or a patient that actually has cellulitis of the lower extremity. And something more systemic, again, I did mention the common flu, which signs and symptoms of that would be the general malaise, headaches, congestion, fever, in addition to sepsis. Sepsis would be have started as an infection and then can evolve into septic disease, which then evolves into multi-organ dysfunction syndrome. So that is the definition of a disease, and those were my notes. Etiology would be the known cause for that disease, and there could be various causes for what might initiate a disease, such as it being bacterial, such as a pneumonia, or viral, such as a rhinovirus. Environmental, the effects of the atomic bomb in Hiroshima, or the radiation in Chernobyl, how it's affected many lives there. Physical forces, such as a motor vehicle accident causing trauma. Chemical, we know that right now there's a lot of exposure around acetaminophen. Genetically, was a child born with juvenile diabetes, or is it inherited to have mental disorder, or something like arthritis, high cholesterol? And idiopathic etiology would be etiology of no known cause. Etiology, and those are my notes that I glanced at. In talking about pathogenesis, it is how a disease evolves from the initial offense to its ultimate expression in the body, being able to visualize all the signs and symptoms and characteristics of that disease. So for instance, neoplastic disorders, which end up evolving into cancer, inflammatory pathogenesis, how inflammation affects the body, and there's different diseases such as lupus, which is a disease of inflammation, rheumatoid arthritis, something degenerative such as osteoarthritis, renal failure, which actually ends up starting as stage 1 kidney disorder and then evolves into chronic kidney disease, and then eventually end-stage renal disease. A metabolic disorder, pathogenesis would be an example would be diabetes. Again, was it congenital, or was it acquired later in life as type 2 diabetes? And maybe I won't get into it actually, but this was pathogenesis, and those were the notes that I glanced at. Signs and symptoms. So a sign is anything that would be considered objective. A symptom is anything that would be considered subjective, that cannot be experienced by the practitioner, by the provider. Such examples of symptoms would be: I am experiencing headache, shortness of breath, nausea, malaise, generalized weakness. I am experiencing this. A sign would be anything that could be measured and identified by a practitioner. So for instance, I'm at the doctor's office, doctor obtains a blood pressure of 120/80, heart rate of 60, listens to my lungs are clear, and I will say there is a gray area, as we discussed, that if I am reporting a temperature 98.7, but then that would be considered still a symptom because it was not visualized by that practitioner, medical provider. So in that instance, it is still a symptom, and it is not a sign until it is observed by that medical provider. Sign and symptoms, and those were my notes. Next, I will be talking about syndrome. So syndrome is a compilation of signs and symptoms that are characteristic of a specific disease that occur in a recognizable pattern that have no known etiology and no defined pathophysiological event. And it could have multiple causes, but my favorite example I'd like to deliver would be that of which one came first, the chicken or the egg? In the example of metabolic syndrome, how do we know that it was obesity that caused insulin resistance and then caused blood pressure elevation, which then ultimately caused hyperlipidemia, or was it insulin resistance then which increased weight gain and hyperlipidemia that caused an elevated blood pressure? These are all signs and symptoms of metabolic syndrome, but yet we do not know which offense started one another. And that was syndrome, and these were my notes. Diagnosis and diagnostic tests, not in the order that it was presented in the rubric, but I figured that these went much better together. Diagnosis is the designation given to a disease or a health process, and it is a combination of physical exam, interview, signs and symptoms being presented by that patient, and considering diagnostic tests such as blood work and imaging. One of the things that have to be considered in a diagnosis, or to completely consider diagnosis, would be things such as age, lifestyle, genetic background, race, gender, labs and imaging such as X-ray, MRI, CAT scans, because all of these things in combination can provide a different diagnosis. So the diagnostic tests are tests that are an objective finding. Running those labs, a troponin would be an objective, a definitive finding of having a myocardial infarction. And it could help to find the presence, the cause, and the severity of that diagnosis. So depending on, I suppose, a chest x-ray could define a pneumonia, a CAT scan MRI could define a tumor. A functional test, for example, in an assessment, doing an EKG could help define an atrial fibrillation in a code of blue, how to respond to ventricular fibrillation. In a surgical procedure, being able to do a biopsy would be the difference between being able to diagnose a benign tumor or maybe a metastatic tumor. And imaging, I did give you the example of that pneumonia, MRI, and then CAT scan. And then complications. Complication is a secondary pathological event that was not expected, but could happen during, after, or as an outcome of a treatment or a medical procedure. This could be acute or chronic, and it was not part of the original disease, but could also affect the prognosis in the sense of morbidity or mortality. And the first thing that really comes to mind is, I suppose, I've heard of broken heart syndrome, where depression and then somebody dies because the depression is so severe that their system ends up failing. In surgery, you could have post-operative complications such as a surgical site infection. Incision gets infected, cause an infection, increased white blood cell count, fever, then has to be treated with some sort of different antibiotic. And in the same example, NIC, narcotic-induced constipation. Patient has surgery, they're on pain medication, and they need, they're taking narcotics, which result in constipation, which then causes other problems, and will then need laxatives and stool softeners. And these were my notes for complications. Thank you for observing this really long presentation. I try to be as thorough as possible. And then these were my notes, just so you can see. I tried my best to memorize everything, and I just had little points of to remember, so I could help define these things. All right, thank you.